Good morning, everyone. So the topic of my presentation is role of MDM2 SNP309 gene mutation in Tresium. So Tresium, as you all know, is a fibrovascular fold of conjunctiva that encroaches onto the cornea in the interpalpebral aperture, and it can be associated with significant visual morbidity. And histopathological characteristics include elastotic degeneration, chronic inflammation, and vascularization. The etiology is not clear. It's a multifactorial, and various external or environmental factors they are thought to act as triggers to induce aberrant fibrovascular proliferations, resulting in its development in genetically predisposed individuals. And Tresium exhibits some of the characteristics of neoplasia, like abnormal cell proliferation, local invasion of adjacent tissues, and recurrence on excision. So recent studies have advocated that Tresium might indeed be a neoplasm-like growth disorder occurring in susceptible individuals. And MDM2 gene, it's a human homologue of MOS double amino 2 gene. It has an important negative feedback, autoregulatory feedback loop with P53 tumor suppressor genes, and elevated levels have been shown to of P53. It activates the MDM2 gene transcription, resulting in its increased expression, and so its P53 is negatively regulated by MDM2. There are other loops also by which these two genes, they kind of interact with each other. And this SNP, single nucleotide polymorphism 309, is located in the promoter area of MDM2 gene, and it has been hypothesized that genetic variant may have an impact on expression of MDM2, and it affects the individual's susceptibility to developing tumors. And it has been previously reported, especially in a lot of internal carcinoma like colorectal carcinoma and tumors of other parts of the body. Based on this background, we aim to investigate whether this polymorphism was associated with the formation of Tresium. So we included 37 patients of Tresium and 49 controls. Peripheral venous sample was collected from all the patients. And the diagnosis of Tresium was established on the slit lamp by a fibrovascular fold encroaching at least 1 millimeter into the peripheral cornea. Control group was patients who came to clinic for refractive errors unrelated to Tresium, and patients with associated ocular or systemic hereditary disease were excluded. After the blood was collected, it was sent to the molecular biology department of Guru Nanak Dev University, where they used a standard protocol and used these primers to do a PCR. These are the results. So we found that there was a higher odds ratio for TT as compared to GG and GT in the Tresium population, but this did not reach statistical significance. This is a representative diagram of picture of a gel electrophoresis, and you have, like for GG you have 2 bands, for heterozygous you have 3 bands, and for TT 2 bands. Similar findings have been shown for other tumor markers also, like large tumor suppressor gene 1 and 2, and as well as cytotoxic T lymphocyte associated antigen gene also. So to conclude, although TT had a higher odds ratio in Tresium group as compared to controls in our current study, the difference was not found to be statistically significant, and further studies with a higher number of patients and control may provide a better understanding of role of this gene mutation and its association with Tresium. Thank you for your attention.